In today's Midday Fix, just last week was Men's Health Week, and you may be overlooking a key factor in overall health, good oral hygiene. And here with some advice is family dentist Dr. Tim Stirneman from All Smiles Dental in Algonquin. Good to have you on the show, Doctor.
Thank you.
In fact, there's a lot of men don't get regular dental checkups, do they?
No, in fact, about a third of men haven't had a checkup in the last year. And when they do go, they usually wait until it gets really bad, and then there's not a whole lot we can do for them.
And their dental hygiene is not as good as it ought to be either. Is this something just exclusive to men?
Well, typically men don't brush their teeth more than once a day, and when they do, it's only about 30 seconds.
So it's got to be, what, at least twice a day, once in the morning, once before bedtime?
Yep.
Is that the way it works?
Yep. Yeah, about 2 minminutes.
And I get the feeling if a lot of guys like me, you really have to think about that 2 minutes, right? I mean, you almost need you need a stopwatch or something.
One of the things
right?
you can do is just hold your phone and just look at Facebook or check your emails or something.
You bet. Here's something I didn't know. I didn't realize that men are at greater risk for developing oral cancer, throat cancer.
Yeah, men typically get cancer or oral cancer about twice as often as women, and it affects men over 40 at a rate of about 95% of all oral cancer is men over 40.
What are some of the causes of that?
One of the studies that they found is diets low in fruits and vegetables have been linked to an increased oral cancer risk.
Right. Well, let's get to some of that. Let's get some of the ideas, some of the recommendations for good dental health, good oral health.
Yeah.
Again, we talked about brushing twice a day for 2 minutes, and things you need to do to make that 2 minutes pass. You can check your emails. And what is this routine reboot?
Yeah, that's whenever I talk to men, not very many men floss. So if you can just start flossing, okay, that's a really good thing.
What can you do to get them to do that? It's not that difficult.
Well, we got these little things here that are easy to use. These little floss pick things, and that kind of stuff. It's hard to get anybody to floss, but
yeah. Well, what do you think of the high-pressure water treatment devices like water pick and that sort of thing?
Oh, yeah, those are really good.
Those are useful?
You get a water flosser or via electric toothbrush. We brought a couple of over-the-counter electric toothbrushes. But
do you prefer those? Do you prefer electric toothbrushes?
Yeah, those are always better.
Now, let me tell you something. I've been warned about brushing too hard. Is that a problem, in particular with guys over women?
Yeah, a lot of times.
Do you think this is some kind of muscular thing?
I don't know if they think that they're like brushing a toilet or something, but you don't need to brush very hard, okay?
Like brushing a toilet, huh?
Well, no, you don't want to. No, it's not like that. You want to use a soft brush, and you just want to brush normal.
Right. Well, finally, let's talk about some of the food fixes. The type of food you eat can actually give you better oral and dental
yeah, absolutely.
health.
The first thing, surprisingly, is cheese. Cheese has got phosphates in it that help to strengthen teeth, and it also can moderate the pH from more acidic foods that you eat. And you don't need that much. You only need about a third of an ounce, Dave.
Okay, and fruit, and in particular fruits and vegetables that are sort of hard to bite into.
Yeah, those actually act like natural toothbrushes. Like carrots and apples and stuff. They can actually help to clean off the teeth.
Well, great advice, Doctor. Good to have you in, Dr. Tim Stirneman. Men, get to the dentist. All Smiles Dental, located at 1452 Merchant Drive in Algonquin. Good to have you in, sir.
All right, thank you very much.